Good afternoon, everyone. Welcome to the International Seminars on Health, a course offered by the Postgraduate Program in Nutrition at the Federal University of Santa Catarina, Universidade Federal de Santa Catarina, UFSC. I am Ana Carolina Fernandes, one of the professors of this course, together with my colleague Deborah Hige, who is here also. And we are pleased to have you with us today again in our third day of seminars of this course and the last one, unfortunately. And there are also some students here at the StreamYard platform and online via YouTube. And today we will have the last speaker, Sabrina Granheim. And our student, Luana Kern, will be hosting her and talk a little bit more about her similar themes of research later. So for each seminar, you have a presentation that will last between 15 and 30 minutes, followed by a 15 minutes question and answer session that will be open also for the public in the YouTube stream to ask questions and discuss with Sabrina as well. So thank you very much, Dr. Sabrina. And thank you, Luana, for this invitation.
Good afternoon. My name is Luana Kern. I'm a doctoral student in nutrition at the Federal University of Santa Catarina. And it's a pleasure to introduce our guest speaker, Dr. Sabrina Ionata de Oliveira Granheim. Sabrina is Associate Professor in Food, Nutrition, and Health at the Section for Public Health, Campus Haverá, of the University of Inland, Norway. Originally from Brasília, Brazil, she has built an academic and professional career focusing on global nutrition policy, food environments, the human right to food, nutrition education, health communication, and public health nutrition. Over the years, she has collaborated with governments around the world and with United Nations organizations. Her research takes an interdisciplinary approach to exploring the digital food environment with a particular focus on how digital technologies shape food practice. So thank you, Dr. Sabrina, for accepting our invitation to share your knowledge with us. And the stage is all yours.
Thank you so much, Luana and professors, for inviting me to present for you today the research that I have dedicated now several years building and developing, trying to advance the idea of a digital food environment and which we all experience in our everyday lives, and really trying to understand what it is and how it functions and how it differs from traditional food environments or non-digitalized food environments. So I am going to present today the framework that I have developed with colleagues, which is a theory explaining this social phenomenon called the digital food environment. And I will also discuss some challenges and opportunities for public health policy of such digitalized food environments. So as a starting point, I would like to, for some it might be a reminder, for some it might be something new, but to understand what is the food environment before we talk about the role of digitalization in such environments. So if we think about the situation in the world, and I will be taking a global perspective, so of course when we look into specific contexts, this may change a little. But speaking generally, in very general terms, at the global level, we are seeing a number of concomitant health problems related to nutrition. We have the multiple burden of malnutrition and non-communicable diseases. So malnutrition understood as to encompass a number of conditions related to lack of nutrients and energy, but also excess. So undernutrition, deficiencies of micronutrients, food insecurity, but also overweight and obesity. and non-communicable diseases that are several of them diet-related, such as cancer, diabetes type 2, many cardiovascular diseases. So we are seeing a global, a very heavy burden of these diseases in society, and they are unevenly distributed across countries and within countries as well in different communities. These conditions have a very high burden to society. If we think in economic terms, like in the green box here, we can see that an estimate by the World Obesity Federation estimates that the global costs of overweight and obesity are estimated to reach $3 trillion US dollars by 2030. And 18 trillion by 2060. So it's so huge amounts of money that I even have a difficulty grasping what it actually means. But of course, it's not only a challenge in terms of the economic burden for societies, for health systems, but also for the human burden in terms of early death and in terms of loss of healthy life years that people could have, but have to live with worsen health or with disability because of these conditions. So this is the situation as of that we are experiencing. And the immediate cause, one of the immediate causes of these problems is, of course, dietary intake, what we eat, and the characteristics, the quality of dietary intake. Dietary intake, by turn, is influenced by, is of course determined by food choice to the extent that we have a choice, and we can also problematize that understanding of what is actually choice. But it is one of the factors that influence what we eat, is what we choose. And of course, the food environment then is a very big determinant of our possibilities of choosing a specific diet composed of specific foods which are healthier or unhealthier. So in that sense, the food environment, maybe I can, this is better. So in that sense, the food environment is a determinant of dietary intake, a determinant of dietary quality. It is a cause of the cause of the cause. In the food environment, there are several frameworks explaining and some definitions about what it is, but in general terms, and building on the most influential definitions by Boyd Swinburne and Christopher Turner, it usually encompasses physical access to food, so the foods that are available in shops, for example, but also economic access in terms of the foods that are affordable, so what one can afford to buy, even if it is available physically. Of course, it has to do with the nutritional quality of the foods that are available, with the food marketing and the social cultural context, to name a few items that go within that definition. So you can see in contrasting these two pictures, we can very easily imagine that the likelihood of choosing to eat breakfast cereals is much higher if you live in a food environment where a supermarket looks like this, in contrast to a supermarket or a local shop, a local market that would look like this. It doesn't mean that it will determine that everyone, or that because it is available, everyone will eat breakfast cereal, but the likelihood of the consumption of breakfast cereal being higher would be in such an environment as in the right compared to the left, to the food market on the left. Another example, thinking of restaurants and not supermarkets, would be the likelihood of choosing to eat a salad would be much higher if we were in a context where local restaurants looked more like this on the right, rather than like serving hamburgers and fries on the left. But of course, given that prices would be similar. So these are just very broad examples to show how it impacts our food choices. And so the food environment surrounds us and shapes our possibilities to choose, and shapes what we choose to buy and what we choose to eat. Another characteristic of the food environment is food marketing. And in many Latin American countries, in countries in the global south, we are used to seeing marketing, for example, look like this for sugary drinks. But increasingly, we are seeing at the global level that marketing looks a lot like this. And these are screenshots from my own TikTok feed. We have a delivery service, and we have, of course, a fast food chain. So marketing increasingly digitalized. And that is because the food environment is becoming more and more a digital food environment. This image is part of the framework that I have proposed with colleagues to identify what is the digital food environment. So at the center, we have the food practices, the things that we do about food, either material food practices that relate to food as a tangible object, or the social practices that we do about food, like sharing food information or taking pictures of food, or even eating with others, right? So all those practices, all those things that we do about food, they compose the food environment. But digitalization is adding a layer of complexity. So it's expanding our experience of the food environment and thus composing a digital food environment. That is not to say that everything is digitalized in a digital food environment. The proposed framework talks about analog, so non-digitalized practices within the digital food environment, in a gradient of increasing degrees of digitalization up to a point where digital technologies replace our food choice. So here we can think about people living in a highly digitalized society that still choose to not engage in digitalized food practices. Whereas on the other hand, there may be, now that we can see, for example, with generative artificial intelligence, that we can ask AI to generate a weekly menu and use AI agents to order food online and get it delivered to our doors, totally replacing our human agency in making that food choice up to the point that it is delivered to the door. So it is really about a gradient of change that is happening in food environments. And of course, it is not happening to every individual or to every country at the same level. It varies depending on the context. So the proposed definition of the digital food environment that we have is that it is an augmented space where these social and material food practices happen, and that they are mediated, enhanced, enabled, or replaced by digital technology, influencing food consumption and then impacting, of course, nutrition, health, and equity. This definition and framework, they are part of a broader middle range theory of the digital food environment, which I developed as part of my doctoral research, using a critical realist grounded theory methodology, which I'm happy to talk about if anybody has questions about that. But I would just like to highlight just wanted to point out what kind of research is supporting this framework, but of course highlight some specificities of this model, which is the fact that it focuses on food practices rather than behaviors. So it focuses on what people can do about food rather than to what extent individuals are engaging in specific behaviors, because that can vary and the practice can still be digitalized. And I'm happy to expand on that to make it clearer. But another important thing is the fact that the digital food environment, some people understand it as just what happens online. That is not my conceptualization. That's not my understanding of the digital food environment, because it is also happening through enhancement of physical spaces as well as happening in digital spaces that I like to use the word cyberspace for. And of course, the framework is about showing the interplay between agency and structure, which I will explain a bit more. So to give an example of the issue with physical and digital spaces, maybe when we think digital food environment, the first thing that comes to mind is, of course, social media influencers and that sharing recipes and food information. Or maybe even dietary apps like MyFitnessPal, where you can do dietary tracking. right? So these are happening in cyberspace, on the space of the internet or of the bits and bytes. But we also have examples of digital technologies changing food practices in physical spaces. When we have food delivery companies using automated robots, or when we have robots replacing waiters, servers in restaurants. And this is a picture of a cat robot from actually a local restaurant here in Norway where I live, that my kids absolutely love when the cat is coming to deliver the food. So you can think how that changes the way we are doing things about food in physical spaces as well. And when I was doing and when I published the framework, I didn't see many examples of how food preparation, for example, is being digitalized, because we like to think about food as a material thing. So, of course, how can we digitalize the act of making food and cooking and eat? But we already have examples of digital technology interfering in that as well, like this product, which is a cooking machine where you put the ingredients and it has recipes, it tells you how much, and you just put the ingredients and it does the rest for you, and then it serves. So digital technology is coming into those spaces as well. Now, this is the complete framework for the digital food environment. And in the time that I have allowed, of course, I am not going to cover everything that's in it, but I just wanted to highlight that, again, in the middle here, we have those practices, right? The things that we do about food that can be digitalized to different degrees, the degrees represented here. Of course, these practices, they are done by someone. So we have different types of agents. This is where the agency bit comes in. The agents that are doing those practices as individuals and collectives, but also as organizations. And of course, these practices, the act of these agents is situated in a broader context of social structures. So the digital food environment in itself is a social structure that influences these practices and is built by these practices. So it is a two-way thing. It is influenced by and thus influences the structures as well. But it is one among several other structures like the food system and policies and many other things. And that dynamic has impacts on nutrition, health, equity, but also the environment and human rights. And the way the system functions is heavily influenced by the society that we live in, the period in time we live in. It's called late modernity by several sociologists that have some characteristics that is influencing every sector of society, and then, of course, food environments as well. So I would recommend that those who are interested go a bit more in depth into this. But what I wanted to illustrate with this was precisely the fact that it is the interplay between what we do and who does it with the structures that are generated by the act of those people and institutions. And when we think about those agents, we have to think about the role of the tech sector increasingly in digital food environments, because previously in thinking of commercial sector, maybe we would think of the food industry as a powerful actor, whereas now we also have the tech sector as a powerful agent or a powerful sector taking place and shaping the digital food environment. And increasingly with artificial intelligence and automated technologies, we have the rise of non-human agency as well, as in the example I gave about generative AI and generating menus, just to give a simple illustration. So of course, because of those changes and because of such a complex system, the digital food environment is even more complex than food environments, non-digitalized food environments. For us to understand, it's difficult to understand everything that's happening, but it's also difficult to measure with research and measure the effects on health. And of course, it is more complex to address with policies that can make those digital food environments more health promoting. But I'm going to show some examples of some challenges and opportunities for those policies. Just as a brief overview, the Informers Network has a framework for evaluating food environment policies with a number of domains, going from food labeling, promotion to retail prices and many others, and then of course infrastructure support to these policies as well. And they have digital technology is mostly absent from this framework, but there's something that they are working on. And we have, for example, a study that they published in 2019 showing the status of implementation of those policies in 11 countries. And you can see that red is very low implementation and green is high implementation to the level of a best practice of what a food environment policy could be, according to the framework. And we can see that in general, it is very little green, right? So we would like to see implementation of those policies, these graphs, much greener, showing better implementation. But it is a challenge, and digitalization is an additional challenge to already a dire picture in terms of food environment policies. But I chose 4 areas in the 10 minutes that I have remaining to give you some ideas of opportunities and challenges in food marketing, governance, food retail, and digital food information as well. So if we start with food marketing, so there are several challenges. This image is from Mr. Beast's YouTube channel announcing one of his chocolate brands. And Mr. Beast is the biggest YouTuber with hundreds of millions of followers and his several channels. And this is just one example, and because digital food marketing of unhealthy foods is widespread across every social media platform, but is also present in physical spaces with digital screens. It is very concerning because it uses strategies and uses tools to be very persuasive, to be very personalized, to be appealing to the emotions, to be entertaining, to be disguised, to build on personal data, to be more effective. So it is much more complex than traditional print advertisement. And it is very concerning that the levels of exposure globally to children are very high, very, very high. And again, the fact that it is mostly of unhealthy foods. Of course, we have to think of those unhealthy foods as an object of digital food marketing, but also as the example I have given of Foodora with the robot, but also with Wolt on TikTok. Digital food services are also heavily advertised, regardless of what one person chooses to order from a meal delivery platform. In principle, someone could order a healthier meal within such a platform. That's not the case. That's not what research is showing. That the environment within those apps is not very health promoting either. But even if you were, the services themselves are heavily marketed, and that's something to pay attention to. And the policy implementation to restrict food marketing is very low at the global level. Only about 20 countries have mandatory restrictions on food marketing, but it is unclear, even though it's already little, but it is unclear to what extent those restrictions include actually explicit provisions about digital marketing in them. So those are some of the challenges we are seeing within that sphere. But of course, there are opportunities. At the individual level, I don't see many opportunities here. I am not the glass half full person. I only see challenges because there's also research showing that even when you say, research from England, it's cited there, that even when you add a protective messaging to social media posts, for example, saying that this is an advertisement, it doesn't really hinder consumption. So it doesn't have the protective effect you would expect. So at the individual level, I don't see many opportunities, but at the policy level, so at the national and global level, I see a lot of opportunities for policy. For example, Norway, since October last year, we have new marketing restrictions for all children of unhealthy foods using a nutrient profiling model for all children under 18 years of age, and that covers both traditional and digital advertising. So I think it will be a good opportunity for other countries as well to see how that is unfolding in Norway. The Committee on the Rights of the Child has called very clearly for states to prohibit some digital marketing practices that are harmful, such as the profiling or targeting of children for commercial purposes based on their personal data. And of course, there are emerging tools and frameworks to monitor food marketing, like the WHO click monitoring framework, and a group in Australia that has developed the Scanner alcohol app that uses AI to monitor marketing in social media posts and to identify automatically with very high precision. So the precision issue is very important if we're thinking of using and applying these types of things for regulation, for example. And I know that they have developed this one for alcohol, but they are working on the Scanner food app as well. So this is something that is a very interesting application of AI. Of course, if we think of food retail, we're thinking of meal delivery apps, but also online supermarkets. Current legislation for food retail is largely silent about online retail spaces. Most legal frameworks don't talk about e-commerce of foods at all, even though there's work ongoing in the EU, in China, and Canada on Codex Alimentarius regarding that. And here there are several issues of concern, but I've chosen a couple of examples. So if we think about user interfaces, for example, on a supermarket or in an advertisement, there's technology like heat maps to see where is it that we actually look at in a screen, what catches our eye, and that is used to increase advertisement, but that is also used to develop websites. So what that means is that some places in the website are more prime space than others, both for health promotion or for advertising. That's something to be aware of. And that has implications for food retail. But of course, food retail also has implications in terms of labeling and pricing, not just how the websites are designed. I'm going to show you an example. This is an online supermarket from Norway. So when I open the website, this is what it looks like. And then when I click to go see the products, you can see that at the top, there's some featured products, fruits and vegetables, but there's some sugary beverages and a chocolate that is on sale. I try to see the label and I try to click to make it bigger to read the label. It's not possible. There's the nutrient declaration there, but it's many clicks behind. So much harder for me to actually read the label. It's not the same experience as reading a physical label. So the interface changes the effect of labeling and labeling legislation. That is a challenge because right here, it was much more challenging for me to read the label, adding to the fact that chocolate was very positioned, to catch my attention with a price promotion. At the same time, the design can also be an opportunity. This is the same website, but now going into the baked goods section of the shop. So when I click to buy some bread online, I can see several types of bread, and you can see a green circle and a black and white circle. Those are labeling schemes in Norway. And you can see if I put the mouse on, it comes an explanation of what it means for both. One is the keyhole labeling scheme to show the healthier alternatives within a product category. And the other is to show how whole grain the bread is. So the blacker the circle is, the more whole grain it is. So this made the product much easier for the consumer to have information about it and to understand the labeling scheme because of how the design is implemented. So that's also an opportunity for informing consumers. But of course, another challenge is the fact that digital technologies are emerging and changing very rapidly. So for example, very recently, there has been outrage on social media about the implementation of dynamic pricing on Walmart supermarkets because they implemented this digital tag to products. And they have denied that they're doing dynamic prices, which change throughout the day. So they say they haven't done it, but some consumers said that, yeah, but well, when I saw the label and I saw the product, it was one price, but when I went to the cashier to pay, it was twice as much. And we can see already the implications of such practices for consumers and in terms of social inequalities as well. So that practice has already been banned in one state in the United States, and the UK Right to Food Commission has sent a letter to the Prime Minister a month ago asking for that type of practice, dynamic pricing, to never be implemented in the UK for the sale of food. So those challenges are something that we have to monitor moving forward. Of course, in terms of information, we have a lot of opportunities, and I think this is in the information age one of the biggest opportunities that we have, because the internet has democratized access to information in many ways. It's much easier to find government information, for example, and health guidance. This picture is from the Norwegian Dietary Guidelines website. You can adapt the language when you click on the website to see the dietary guidelines. It's much easier to participate in the policy process, for the government to be transparent about what it's doing as well, and have public consultations of what they are doing. A lot of potential for health communication strategies, and to improve health literacy, nutrition literacy of the population. At the same time, the fact that health information is digitalized makes it much more vulnerable, as we can see happened in the United States in the change of government, where a lot of public health information in government websites disappeared, was removed, or was edited, which means that, yes, digital health information is much more accessible, but it's also much more volatile to change, which makes it a risk. Another challenge, of course, is the widespread use of health misinformation, much of which is nutrition related, and health disinformation as well, with the intent to mislead, which has worsened now in the context of AI, and not just AI generated content, but AI slop, which is occupying a lot of this informational space. An opportunity would be to develop policies addressing those. Like in Norway, we have a specific strategy to strengthen societal resilience against disinformation. And what I wanted to highlight about this strategy is the fact that on issues, the five strategies that they want to implement, the first is about increasing individual critical media literacy, but the second is structural. It is about holding social media platforms to account, holding them responsible for those challenges that are taking place on the cyberspace, and the spaces where they are responsible for providing infrastructure as well. So those are examples of policies that can be enacted. And of course, in terms of governance, we have a lot of challenges, for example, because now, as I said, the tech sector is an important part of the food environment. And because many times when we think of, we have so many challenges, how do we fix it? We see the proliferation of technocratic solutions to nutrition problems. And what that means is that, okay, let's make an app to fix that, or that there's an app for that phenomenon. That doesn't fix structural problems, and that is an additional challenge. Added to the fact that these companies are very powerful, they operate with very limited government oversight, and they try to undermine regulations that are being developed. But of course, opportunities is to keep implementing health in all policies. So public health and public health nutritional professionals are very used to operating across sectors. So as in the rainbow model, we have several sectors where it is important to think about health. And the tech sector or digital infrastructure would be an added sector to the rainbow model. And then using AI to not just to make new apps, not just to thinking individually, but thinking about how can AI tackle population level problems? How can it process data on complex health determinants? How can it uncover relationships in the analysis that we humans haven't been able to, and so on? How can we apply to those complex analyses? And of course, how can we train the public health and public health nutrition workforce to work across sectors, including the tech sector, to work using digital technologies for health, and to influence the tech sector as well? Here, this is an opportunity, but I just wanted to say that it is also a challenge, because as an example, a study in the EU show that it was looking at academic curricula for public health professionals. And if you think of the infosphere and health misinformation, as I was talking about, just 2.5% of academic curricula on public health at the European level had something about that. So we need, if we want public health workforce to make that change, we need to start training that workforce more on the digital as well. And to finalize my presentation, I just wanted to remark that whenever we think about the digital food environment, it's important to remember that of all the structural determinants of how the digital food environment is structured, the commercial determinants of health are one of the most important, because of course, technology is part of that infrastructure for the digital food environment, and tech development is led by the business sector. This brings a number of problems. The problem with playing tag, so we're always trying to catch up. Research is not quick enough, as quick as the business sector and the tech development. The policy process is not quick enough either. So there is a challenge that we're always trying to catch up. And another problem is a problem with path dependence, because once we go into specific policy pathway, it's not impossible to change, but it's much harder when you go from having a lot of possible policy solutions and you go down a path, then the number of possible solutions, it diminishes, and maybe it's not the best solutions that are being implemented, but those become the possible ones because of the dependence on the actions that have been taken prior. So this means that whenever we are operating with digital policy, we have to be quick and really follow what's happening, both in terms of understanding the phenomenon and also trying to enact policies. So that's what I had with the time that I have been assigned. This is my email. You can find the link to my socials on my link tree. And then, of course, I have my references there, which you can't read, but I'm happy to send to anyone who is interested. Thank you so much.
Thank you, Dr. Sabrina. It was very interesting to listen to about your work. And it's very interesting also to perceive the duality of digital food environment, because it can act both in negative and positive way in health and nutrition. And now we will have a section of discussion and questions. And so I have some questions for you first. And afterward, we will open the conversation for other colleagues to ask questions in the chat of the transmission, okay? So my first question to you is about the scientific literature on the digital food environment, because we noticed that a large portion of the studies address the practice and effects of internet and social media use on children and adolescents. Does this population remain the primary concern, or should we also expand our focus to include other population groups?
Right. My evaluation is that children and adolescents, and other vulnerable groups, they are the priority because they are vulnerable. Because we as adults, we as a society, we have a responsibility to tailor research and actions to those populations and to protect them, to protect those that can protect themselves. So that justifies part of the reason why those populations are the focus of research and the most strict policies, right? But that is not to say that we shouldn't look into other population groups, both in terms of actions and in terms of trying to understand the problem. Different problems affect different population groups differently. And part of the nature of this field of knowledge, studying the digital, is that it happens, as I said, it changes all the time. It happens very quickly, and it is very new. Digital technologies are not new, but the digital society, as we see right now, it has changed very quickly in the past 10, 15 years. Social media has been a key driver of that. It's not the only one, but it's one of the main drivers there. So, of course, it is a new scientific field, and there is a lot to be researched. And I understand why many people start with children and adolescents, and I would support that. my own research hasn't focused on children. It has focused on young women and globally, not any specific group for the theoretical part. And there's also justifications for that. But I would definitely welcome more research into other groups and adults and the elderly as well, and in different parts of the world. I think a big misconception, speaking as a person from the global south that lives in the global north, a big misconception in the global north is that things happen slowly or that things are not happening in the global south countries. So many people from high income countries have no idea to what extent digital technologies are integrated in the everyday life of Latin American countries, for example. They don't understand how it is actually happening, but it is. So I would definitely welcome a different lens into those effects as well. And unfortunately, we know that research is mostly funded in high income countries in this area. My research is showing that as well, that most research in the digital is coming from high income countries. So we also need to expand in that sense in terms of geographical distribution.
Yes. You talk a little now about your work with interviewing young human. Could you comment a little bit more about this process and how it contributed to your work?
Sure. It was very interesting to work with young women. I think the main justification there were several, of course, they're described in the papers, but part of the main justification of choosing young women to try to understand the digitalization of food environments is that I worked with women between 18 and 25 years of age. And in the context where I live, in the context of Norway, it is a very transitional period. So many of them, it's very common to leave home, to go to university at another stage, or to start a family, or to go live alone and get a job. So suddenly, those young women or young people in general, they become more responsible for their own food choices. So they engage more actively with their food environments, with less interference from parents, for example, at the same time that peers continue to influence a lot. And even in quite equal societies in terms of gender equality, like the Nordics, Norway, Sweden, Denmark, women still bear the heavy load when it comes to food practices, food preparation, cooking, meal planning, and all of that. So studying young women was very interesting to be able to see some of those nuances that maybe other groups wouldn't have allowed. And I was very surprised to see how many of these women actually were very aware of things that maybe I had a misconception before, that they were very naive, that they see something on social media and that they believe everything on social media, you know. But many of them were extremely critical and aware of misinformation, aware of impact of misinformation or influencer culture on body image, on their mental health, on their physical health. Many of them were very critical of marketing. But of course, this was a qualitative study. So I'm saying many of them, but it's not about the quantity, it's about what they were saying. So it was very interesting to see that they were actually quite critical. And it seems to me, based on what they told me, that the fact that they went through high school with teachers that talked a lot about the dangers of social media and that discussed this openly made them very aware and more critical of those types of content. And I think that was surprising to me to the extent that it was. And I think that's something that I would like to investigate further and in other contexts to see if there's any similarity or is that a Norwegian phenomenon, right? So that was very interesting. But then, of course, that was enough to develop an understanding of how things are happening within that context in Norway, but to develop a middle range theoretical framework that has applicability to other countries, then I had to extrapolate from young women, but also build on existing scientific literature from many academic fields to try to understand what's happening. And there I build a lot on human geography. There's fantastic geographers that are studying the digital space and see what it actually means. A lot of very good public health nutritionists that are doing empirical research on meal delivery apps, for example, and other things. And of course, sociologists there are telling us how society is changing, and all of that builds into the understanding of what is this thing that is the digital food environment, right? So it was really using the grounded theory approach and going from the empirical data, starting there, but then abstracting to different levels to be able to make some theoretical generalizations, not statistical, but theoretical generalizations.
Thank you. It was very interesting to read your work, and now listen to you to speak more. It's very, very interesting. So thank you. Um, your work has a strong interface with public policy formulation in collaboration with governments and with United Nations organizations. How do you see the relationship between scientific production and policy decision making?
Right. I really like this question because that's the dream, right? That policy is informed by science, and in practice, that's not always the case. So that is the struggle. I don't know if we will ever reach a point to have that direct connection between, here's the science, therefore we enact policies based on that science. Because the human processes and human social institutions are messy. The policy process is very messy, but it is conducted by a lot of well-meaning people that are very aware of the science and very willing. And I'm speaking at the global level, but of course it varies. But at the global level, generally speaking, these people are very well-meaning and very willing to collaborate with academia. And there are a lot of researchers also contributing to global instances like WHO and other UN organizations in the process of developing guidelines, developing policies, and studying, testing policies, monitoring and evaluating. One of the things that is not so much talked about yet in terms of the digital food environment specifically, but very much in global nutrition policy, it is part of the job, is really the role of doing advocacy, public health nutritionists, public health professionals working in the building awareness and building capacity of politicians, of local policymakers, to help them understand the science, because we can't expect every single policymaker to be able to read systematic reviews and be up to date with the science. So of course, we have those agencies trying to facilitate and digest the information and present that in a way that is palatable and understandable, as to try to influence the policy process. But again, it is a messy process that is also very influenced by commercial interest. That's why I finished by talking about the commercial determinants, because we know that the business sector has a lot of power and influence in policy process at the global level and at the national level. And that is in many ways counterproductive to what we are trying to do in bringing more science into the policymaking process. So it is the struggle that is part of the job, and it's always good to see when there is progress going on.
Thank you. We have a question here in the chat of YouTube from Laura. She's researching about delivery apps and here in Brazil. And she thanks you for your excellent presentation and said that your article illustrates the complex relationships among actors in the digital food environment. What was the biggest scientific and personal challenge for you?
Okay. In terms of developing the theory, I think that's what Laura is thinking about, right, in the 2025 paper. I think the biggest scientific challenge was the amount of data and doing interdisciplinary research, because it's trying to look at a phenomenon from bringing in insights and data and understandings and concepts from disciplines which are not my own, or not my original. Now I see them as part of my own as well, but really trying to and feeling out of my depth in many situations when I started reading more sociological texts and reading sociological theory to be able to understand what I was seeing happen in the empirical data, it was very challenging, but at the same time, it was very rewarding when, the learning curve was very steep. But trying to bridge that gap between the different disciplines and combine those approaches. And again, the amount of data and the amount of reading was insane. So I don't know if I ever will be able to do that again. That's the type of thing that you do when you're in a PhD. But I'm very happy about the result. And of course, the model is imperfect. The theory is meant as a starting point for people to take it further and develop it further and find holes and fill the holes, fill the gaps, But it is a starting point, trying to systematize this complexity. And I think at the personal level, the biggest challenge was that I was doing my PhD, and then there was a pandemic. Living in a country with no social support network or little social support network, I can say no, and with small children. So there was it took time, it took energy, but yeah, I think it's those challenges that you, in a way, it was. I told that to a colleague the other day. That in a way it was good that life was messy and that it took me longer, because it gave me time to process, speaking of the scientific challenge, right? But so it gave me more time to process. But also, if I had finished by the time I was meant to be finished, I would have published a framework just a month or so before the release of ChatGPT. And that changed a lot of things. So the delay, and that's something that I take with me, is that sometimes to be patient, because that delay gave me also time to take into account the advancements in generative AI, which I had been following, but because they were not widely disseminated, they weren't available to the public. So it was more, following it in the tech sector with the potential to the future. But with the release of ChatGPT in November 2022, everything changed. And there was a lot of things to add to the framework, and that it changed my understanding of the conceptualization as well, right? So the model takes that into account, thanks to the fact that life was also messy with challenges and not being a mom, and I was lucky that I had the time.
We have a question from Professor Paula Horta from Universidade Federal de Minas Gerais. And she has a question. To what extent does the proposed digital food environment framework represent the context of Latin America?
Yeah, that is a very good question. And hi, Paula. It's good to see you here. The framework, if we're thinking about the framework that I published based specifically on the empirical data of young women, then that is more specific. Then that is what in sociology we call a substantive theory, which is applicable for the group of young women, which is in the Norwegian context. So that is very specific. The theoretical framework that I presented today is an ontological framework that builds on scientific data from all over the world. Latin America is underrepresented in that data, but what I was looking at was, and this is where the part where looking into practices and looking at ontology, what's the nature of things, what are the big processes that are happening, helps. Because the framework is non-directional. It is not saying it doesn't have any weight. It's not saying if it's more challenges or more opportunities. It doesn't say which are the practices are mostly impacted or not impacted. So in that sense, it can accommodate, because it was meant to be abstract at the theoretical level to be widely applicable. So it can accommodate practices that are throughout the world, even though, so for example, one of the practices that are described in the framework is digital food retail, the buying of food. In Norway, meal delivery apps widely disseminated. I know in Brazil, we also have a lot of meal delivery apps widely disseminated. But in Brazil, in some cities, we also have the informal use, so informal digital markets, the informal use of WhatsApp by local restaurants to send the menus to the customers, and then people order through WhatsApp, and then the motoboy comes and delivers, right? So that is a very specific manifestation of the category, the broader conceptual category of digital food retail. So in that sense, the framework applies because that specific behavior, that specific practice can be accommodated within the abstract category. But the framework doesn't describe it. It is really at a different level of abstraction. And there's really further research, specifically in the context of Latin America, in the context of South Asia, in the context of, other countries, that will show the actual manifestation of those practices and how they vary. But the general categories should hold for a while. And I believe that there is room for improvement as well. Maybe we will find things, further research will find abstract categories that are not described there. And then I would encourage colleagues to further develop the model and publish the updated version. That's what a living model is for, is to serve as a starting point for us to ask questions. The theory helps guide some questions and show the different moving bricks of the complex system, but it doesn't really tell how the pieces in a specific context interact with each other. That's a local description that has to be then adapted and done for specific contexts. So that would be my understanding of the theory.
Thank you. And my last question for you is, what advice would you give to students and young researchers interested in investigating digital food environments and public health?
Yeah. What advice? I would say get on with it. It's as I said, there's so much to be investigated, and it's really exciting, really, really exciting. You learn a lot, and of course, that's true for every field of research. But digital technology, studying digitalization, it's so dynamic, so it's never boring. I can guarantee it's never boring, but it requires that you are really aware of what's happening in your surroundings, and that the pace is really quick. So I would definitely encourage people. We have so many research questions out there that need to be answered. I would absolutely love to see more empirical research taking place in Latin America, comparing different countries and showing not just showing challenges, but also showing some of very innovative, creative solutions using digital technologies that are coming from the global south, that the rest of the world can learn from. So I would really encourage a research on what's happening to understand the context, but also research on what do we do about it. So how do we implement? What is innovation from a public health perspective? That's not just making another app. That's not just making a website. What is innovation for the human right to food? What is innovation for health equity, right? So how do we do that? And I think Latin American countries have a lot to contribute in that sense.
So I would like to thank you again, Sabrina. It was an honor to learn more about digital food environment research and your work and professional career. And your lecture was very inspiring to us. So thank you.
Thank you for the opportunity and the invitation. I am happy to receive questions via email if anyone has thoughts after the lecture. And I really wish you good luck with your doctoral studies, and to anyone wanting to pursue this very interesting area. I would love to hear about it and to help you disseminate as well what you're doing, because the world needs to know about it. Thank you.
Thank you very much, Dr. Sabrina. We all in PPGN work a lot with the food environment, not only the digital, but the real one, the urban environment, and also in store and in the establishments inside them. And it's very good to know that we have this theory. We all know no theory is perfect, but it's very complete. And it's very good for us to have this reference, and very proud that you are also Brazilian,
Very
who is
proud of that as
contributing to
well.
the science of the world internationally. And I think it's we are ending our class with this great seminar with your expertise and experience, and with a Brazilian who is abroad. And I would like to thanks a lot as well, Luana, for inviting and hosting, Sabrina, to Professor Deborah for this collaboration again in this course that we love to teach on. And thanks for all our audience. And I would like just to highlight that if someone needs a certificate for the participation, there is a link of the Google Forms to ask for the certification in our chat on YouTube. And this is our last class, but we hope we have this course again next year, and to have you with us as well. We are seeing all of our former students keeping with us in this course by the chat, by the monitoring the discipline. So I would like to thank you as well, Laura Volpato, who is our PhD student going to Canada in few months, and stay with us in this course, also helping and contributing to our contents. And I hope to see you soon to the next editions. Also for Sabrina too, if you want to keep in touch with us and participating in our events. I know it's a little bit late in Oslo now.
It's absolutely fine. It's
evening.
my honor.
So thank you very much. And thank you for everyone. Bye-bye.
Thank you. Bye.